topic will be shingles. Shingles is also known as herpes zoster. It's a painful rash caused by varicella zoster virus, which is the same virus that causes chickenpox. After a person has had chickenpox, the virus continues to reside in the body, causing no symptoms. However, later in life, it can become active again, causing the shingles rash. The term shingles means belt. This is because usually the rash appears in a band or belt-like pattern. Varicella zoster virus belongs to a group of viruses called herpes viruses. Up to 20% of people will develop shingles during their lifetime. The condition occurs when people have had chickenpox in the past. Shingles can occur at any age. It is more common in adults 50 years or older. Shingles can occur in healthy adults. However, some people will be at higher risk developing shingles because of a weakened immune system. These patients may be people with cancer, chemotherapy, immune suppressing medications, or infections like HIV or AIDS. Shingles usually begins with unusual sensations of burning, itching, tingling in an area of the skin on one side of the body. Some people also develop a fever, a generalized feeling of being unwell, or a headache. Within 1 or 2 days, a rash of blisters appears on one side of the body in a band-like pattern. The shingles rash most commonly affects the chest, affects the trunk, chest, abdomen, back. The rash can show up on almost any part of the body. If a rash appears near the eye, it can permanently affect vision if not treated. The pain of shingles can be mild, moderate, or severe. It's usually sharp, stabbing, and burning quality. Pain may begin days before the rash appears. Pain is limited to the part of the skin affected by the rash, but it can be severe enough to interfere with daily activities and sleep. Pain is worse in older adults than in younger people. Within 3 to 4 days, the shingles blisters can become open sores or ulcers. In individuals with an healthy immune system, the ulcers crossed over and are no longer infectious by day 7 to 10, and the rash generally disappears within 3 to 4 weeks. Scar and changes in skin color may persist long after the shingles have resolved. In most cases, shingles runs its course without any lasting problems. However, the condition can be associated with complications. It is not possible to catch shingles from another person. However, if you have never had chickenpox or the chickenpox vaccine, you can get chickenpox from someone who has shingles. This can happen after direct skin-to-skin contact with a shingles blister or by breathing in the varicella zoster virus through the air. If you have never had chickenpox or the vaccine to prevent it, you should avoid being around someone with the shingles rash. If you have shingles, you should avoid contact with people who have never had chickenpox or the chickenpox vaccine. Complications of shingles can happen to anyone, but are more likely in older adults and in people with a weakened immune system, people who may have had an organ transplant, people with HIV infection. Post-herpetic neuralgia is a pain that lasts more than 3 months after the onset of shingles rash. It is the most common complication of shingles. The pain typically affects the areas of the skin that were affected by the rash. It can be mild, moderate, or severe, and it's described as burning. Affects 10 to 15% of people, with half of those cases happening in people that are 60 years old or older. The pain usually improves over time, but some people may experience pain for months or years. It may interfere with normal daily activities. There are treatments to treat and prevent post-herpetic neuralgia. Skin infections can happen with a shingles vesicle or sore or ulcer gets infected with a bacterial infection. Eye complications, about 2% of people. It tends to happen when the shingles affects the eye. Potential complications include eye inflammation, lacrimation, itchiness, herpes zoster ophthalmicus, and acute retinal necrosis, which is damage to the retina. Complications can be severe and cause loss of vision, especially if not treated promptly. Herpes zoster can cause inflammation of the ear, called herpes zoster oticus or Ramsay-Hunt syndrome. It includes weakness of facial muscles on the affected side, pain and blisters inside the ear canal. It can be treated with medications and steroids. Treatment of shingles usually includes a combination of antiviral medications and pain-relieving medications. The area of the rash should be kept clean and dry. It is better to avoid applying lotions to the area to avoid further irritation. Antiviral medications stop the virus from replicating. It helps the rash to heal quicker, and it reduces severity and duration of infection and pain. Antiviral medicines should be started as soon as possible. They are more effective when they get started within 72 hours of infection or the rash. There are at least 3 antiviral medications: acyclovir, famciclovir, valacyclovir. Valacyclovir is the most commonly used medication. People may need treatment from 7 to 10 to 14 days. Antibiotics may be needed if there is a skin superinfection. Pain medications may be needed, such as acetaminophen, ibuprofen, different NSAIDs, among others. Treatment of post-herpetic neuralgia may be needed to reduce pain and maintain quality of life. It is safe to go back to work once the area has crusted, which usually takes about 7 to 10 days. Prevention is available with a vaccine. Vaccines can reduce the chances of developing shingles. It is usually recommended in adults 50 years or older. Vaccination might also be recommended in younger adults if the immune system is weaker than normal. The vaccine, if the person develops shingles after receiving the vaccine, the infection may be less severe and there is less probability of developing complications such as post-herpetic neuralgia. Always talk to the doctor for vaccine recommendations and treatment recommendations. Well, I hope this topic was helpful. Join, like my social media pages. Thank you.